Welcome to Adapt NCLEX and thank you for joining the channel. Today I want to make you comfortable with neuro topics. I picked some 4 questions that to illustrate the key neurological problem that you need to know. Not all of them, but just 3 of them. So it's a quick question review, but it will emphasize all the topics that you need to know, a couple of them. So stay around and check it out. Okay, this is the question we have. It's a SATA question as usual, right? And from the last portion of the question, this is very short, so it's very straightforward. Which of the following the next you expect? So the ask is an expected finding, right? A client was diagnosed with Bell palsy after a viral illness. So that's the case. Somebody has a Bell palsy after they have infection from a viral illness. What do you expect? So this is a content kind of select or apply or set a question. So you have to know your content, which is the buzzwords are Bell palsy, expectation, Bell palsy. And then before you make a choice and you rewrite, basically, you got to bring your content. So you got to know that Bell palsy basically involve cranial nerve. It's very confusing. There's a trigeminal nerve, which is cranial nerve 5. Bell palsy is 7. So this is cranial nerve 7. It's a facial nerve. Okay, we call it a facial nerve. And it basically is an inflammation of the cranial nerve 7. Usually, you don't know, the etiology is idiopathic. Okay, that's what it means is we don't know. Sometimes it may be from viral illness. That's the most common. You have some viral illness, and then the nerve get inflamed. Okay, and so the nerve usually is one side, so it's unilateral. I've never seen a bilateral problem. So one side of the facial nerve is affected. Key fact: facial nerve, cranial nerve 7 is mostly motor, okay, on your face. So that's what control motor movement. So your smiling, your movement of your face, your blinking of your eyes and everything is all controlled by the cranial nerve 7. Then in your mouth, you control sensation. So this is key. Motor for the eye movement and other stuff, and then sensation for the mouth. So that's a key fact you have to know. That is a motor function for the face. So facial expression, laughing, and all those things, eye movement, is involved with that. Yeah, basically, as you blink your eyes and other stuff, and your mouth, inside your mouth is involving sensation. It's different from the trigeminal. So that's what they're going to confuse you with. So those are the key information. So that face, and that side of the face, if it's affected, it look like stroke. So affected side, it's like stroke. It look like stroke, but they don't have any head injury or neurological problem. So that face doesn't move at all. So they will be drooling. They cannot move it. Okay. That face will be completely, they can close their eyes on that side. Your eyes, you can close it. So it will be just open like that. You can't make any tears. Okay. No smile on that face. So only one side will be smiling. So it will be asymmetrical. Those are the key things you need to let them know. And then the sensation, I told you the mouth, the side of the mouth sensation, it's lost. That side is completely lost in the mouth. And so the treatment usually that we give them is basically, we think it's a viral problem, so we give them antiviral medication, and then we give them steroids, and sometimes NSAID, anti-inflammatory, to help with that. So these are the 3 things you do to help with the management. The key thing for your test is intervention. teaching you provide them based on what I've told you, right? They can close their eyes. Their eyes are wide open. You don't want to cause corneal abrasion, so they wear glasses in the morning or glasses daytime, okay, and then at night they use a patch, okay. They got to have artificial tears, so that they can cry or they can dry their eyes. It's very important. The side of the mouth that is affected will be drooling, so they cannot chew on the other side. Okay, chew on the other side. Okay. Because of the drooling, you don't want them to eat anything that will make them choke. So, like soft diet. Soft diet is the key, and they need to have good dentition. So, so these are the few things I want. And this is everything about Bell palsy. There's nothing they can ask you that is not on the screen. The diagnosis, signs and symptoms, teaching, and treatment. And that is what select order applies. So we can answer our question. I've given you the content. Prescription for carbamazepine. I never mentioned carbamazepine. All I said was antiviral, steroid, and NSAID. Why did they put this there? This is the treatment of choice for cranial nerve 5. This is trigeminal neuralgia. So this is cranial nerve 5, trigeminal neuralgia. So we don't give them this. Complete resolution of the symptoms after a few months. Yeah, because it's a viral illness, idiopathic, it will go away. Prescription for artificial tears. Yeah, they can close their eyes, so they need something to dry. Wearing patch at night, right? That's the right treatment. Prescription for soft diet, like I said. Drilling on the affected side. Yes, they're going to drill. That side is not moving at all. Unable to feel the affected side of the mouth. Like I told you, the function of the facial nerve is mostly motor for the face and sensation for the mouth. Feeling of your face is a sensory function, and therefore this function is trigeminal neuralgia, cranial nerve 5. And this is what they're going to confuse you with. So my advice for you is, if you read learning about trigeminal neuralgia, you should have Bell palsy on the other side. As soon as you finish this, read that. I call it bi-directional learning, so that you can know that this is the opposite like that. So if I see this, you always watch out for the things they will confuse you with in a select order that apply. And that is what exactly I did. That feeling on that side is mostly sensory and is by trigeminal neuralgia. So those are our answers. And that's the question on Bell palsy. You don't need to read anything anymore about Bell palsy. That's all you need to know about it. So same question, different flavor, right? As usual. So it's a select or apply. Which of the following requires immediate intervention? That's our ask. We can intervene. Something, answer choice has to be an intervention. The client was diagnosed with trigeminal neuralgia, okay, after extensive evaluation. Therefore, which of the following should require immediate intervention? So the ask means we have to intervene in case we have trigeminal neuralgia, and then something is happening that we got to intervene. So you do the same thing. You come up with your content. You said, what is on trigeminal neuralgia that I need to intervene, right? First of all, trigeminal neuralgia, I told you, is cranial nerve 5. Okay, it's 5. That's why it's called trigeminal. It has 3 distribution, and this is what it looked like. If this is your face, okay, I guess this is your face. The nerve start from here and it go up to your face. One here, one go here, and one go here. So it's 3, trigeminal. It's 3. It has the name like a European Roman number. So trigeminal, 3 cranial nerve put together. It's one of the biggest one. And all it does is sensation, like I said, sensation of your face. Sometimes it can also be affected, inflamed, and because it's a nerve that is involving sensation, your symptoms will be what? Sensation, sensation, sensation. So you have like severe, sharp, burning. There's no motor problem or sensation. These are the words they will use, bad words, electric, like shock, like I'm giving you all the things they will put there to trick you. Burning, this is like pain. It's all they're saying is patient has pain. Okay, it doesn't matter. So that's the pain they have on the affected side. Okay, and this is very, very painful, very, very painful. Etiology, nobody knows. But this is the inflammation of the nerve, and they keep on firing, and it can fire in this distribution, that distribution, that distribution. So we have maxillary mandibular branches, that's the on the face. And so you got to, and the symptoms comes in the cluster form. It come in the cluster form, cluster symptoms. Just all of a sudden, it come in waves. Okay, right? Um, the thing you have to know is there's triggers. Your treatment is to treat them. Treatment is usually multimodal, pain medication. So multimodal. Okay, pain medication. Basically, there's a bunch of pain. In case you see a question like that, don't worry about it. You can have NSAID, you can have antidepressant, so you can use it. You can have TCA, you can have Tylenol, you can have steroids. I mean, they can give you everything they want, and then antipsychotic. They use is this one, carbamazepine. Okay, you got to pay attention to this. That medication, carbamazepine, it's very, very important. So they will give you that. So the multiple medication to help with the treatment, right? You're teaching as the nurse, what you need to do is to prevent them from, it takes some time for the disease to go away, but to tell them how to prevent it. Because it's a nerve problem, your treatment is no stimulation. So this is all I would say. Like if you use this word, no stimulation, that's your key buzzword. Therefore, every symptoms is related to that. So you try to find something that you can relate it to every answer choice. The treatment for this problem is no stimulation. So washing face, no, on that side, don't do that. Chewing on that side, no, no, don't do that. Okay. And brushing teeth on that side, yeah, no. You got to use a special uh, brush to do that so that it doesn't irritate it. Anything that you do that irritate it, it will fire. Yawning, no, don't do that. And talking too much, no. So these are your teaching. Tell them not to do that, not excessively, because then it will trigger the nerve, and the nerve will start to what? Fire and fire and fire. So your treatment is basically oral care. Okay, you got to give them oral care. That means the brush, they have to use the Bristol soft and brush. They can brush the teeth and they can so that it doesn't trigger the nerve. They have to avoid extreme temperature. So nothing too cold, nothing too warm. Otherwise, will trigger them. Um, no massage of the face. Like I said, sensation. You don't want to stimulate anything. And no rubbing either. Okay. If you want to chew, don't chew on that side. Chew on other side, right? It look like a bell palsy, you see. What food would you give them? Something soft, like bell palsy. You see, that's why it's very confusing. Um, they should avoid any food that may make them aspirate. And this is the content I've given you. So we will answer our question. Use of so we have, then we can answer our choice questions. So we got to intervene. Use of small bristle brush. No, this is good. Avoid extreme temperature. This is good. Facial massage to help with the pain. No. Regular diet, you need a soft diet. Chew on the affected side. No, you should chew on the other side. Small purple rash on the chest is normal. It's not normal. You have to know this. The treatment of choice for carbamazepine, for the um, trigeminal neuralgia is carbamazepine. Is an anti-seizure medication. I mean, I've spoken earlier on, is an anti-seizure medication. And the two side effects of that is agranulocytosis and the sulfur drug. So you got to pay attention. Being a sulfur drug, they lead to photosensitivity and what we call Steven-Johnson syndrome. And Steven-Johnson syndrome present like a small purple rash on the chest. So NCLEX will not give you this because they have to specify that the patient is on carbamazepine. But I want you guys to think that carbamazepine is the treatment of choice for Bell palsy, even in trigeminal neuralgia, even though you're going to be giving this patient a bunch of medication. Carbamazepine is the treatment of choice for trigeminal neuralgia. And therefore, small purple rash on the chest is not normal because it's a sign of a sulfur issue. Call for URI symptoms while on the prescription. Like I say, it's the same thing. You have to say that the patient is on carbamazepine. Since it's a carbamazepine, it causes agranulocytosis. Any small increase in temperature, you should worry. They may go into sepsis, be sharp moment in sepsis, and therefore you need to call, so you don't need to intervene. The problem is they can confuse you with this carbamazepine and they will give you clonazepine. Clonazepine it also has agranulocytosis, but it's an antipsychotic. It's not a seizure medication. It's not used in trigeminal neuralgia. So these are the answers we got to require intervention. So the next one is Myasthenia Gravis. So very interesting disease process. And I just have a question just to illustrate just basically what it is. In simple term, is this is a simple term of myasthenia gravis. Okay, usually we have a muscle. We all have a muscle in our body. Okay, and then we have nerves. And these nerves join with the muscle in the neuromuscular junction. And these nerves are like myelin. They send information to the muscle and tell the muscle to contract. The information they send is acetylcholine. And in the myasthenia gravis, they have receptors to bind to it, the acetylcholine. Unfortunately, these receptors is being bound by antibodies. Your body is making bad antigens, antibodies basically, to bind to these receptors. So the acetylcholine can just float around. It can bind to the muscle, the receptors, and so the muscles are weak. That is all the pathophysiology. It's weak because it can bind to the acetylcholine to do its function. So every muscle in your body is going to get weak. So you don't have to memorize any symptoms. Your high muscles is going to get weak. Your breathing muscle is going to get weak. Your bladder, your bowel, your legs, everything is going to get weak. Your priority action is airway. So when they ask you about which one you see a priority action, somebody with the airway problem, swallowing problem, breathing problem for myasthenia gravis is the worst. Okay. But the rest, they're going to have high problem and other symptoms. It's okay. What we do is we give them medication that will increase the chance of acetylcholine binding to the receptor. And that's I call them the stigmins, the pheostigmins, or neostigmins. That's their last name. They have stigmins. They will basically bind to acetylcholinesterase. That's the enzyme that breaks down acetylcholine. And therefore, they have high level of acetylcholine, and they can bind to the receptor, and then they can do their job. What your test want you to know is these people are okay in the morning because the muscle have not been working. So as soon as they wake up in the morning, the muscles are really great. Therefore, when you should take your medication in the morning so that you can swallow properly, right? During the day, they get weak because as the day progresses, they get weaker and weaker and weaker. So take frequent rest. Just take frequent rest so that you can recover yourself. Okay? Um, because you want to prevent them from aspiration because of the muscle getting weak, small frequent meal is okay. That's the best way to do that. To prevent, and your number one is to prevent aspiration when they seeing you, okay, in the hospital because the muscle get weak. Guess what? There's certain things that doesn't matter, shouldn't worry you about. They usually have the ptosis of the eye. It's okay. Okay. Um, they will have bladder problem. It's okay. They will have bowel problem. It's okay. That's all expected. Okay. But if they tell you they have swallow, no, that's B sharp. They have breathing, no, that's B sharp. Those two things, in myasthenia gravis, B sharp. So they will tell you dysarthria or something, difficulty swallowing, or dysphagia. All these things are signs telling you difficulty speaking. You got to see them first and intervene. Okay, the treatment, like I said, we give them stigmine to increase acetylcholine. Unfortunately, you can overshoot. When you give them the pheostigmines or neostigmines, you increase acetylcholine. So you have more acetylcholine, and it can go into something we call acetylcholine crisis or cholinergic crisis. And you know that. That means somebody will have too much cholinergic. Therefore, the symptoms you see, you already know that, like, it's opposite of anticholinergic. So if you give them the stigma and they become cholinergic, they are in cholinergic crisis, then increase salivation. So everything is going to go up. Salivation goes up, urine output goes up, they have diarrhea, right? Um, the pupillary constriction. So the people will constrict. Um, and then their heart rate will go down because it's atropine. It's against atropine, basically acetylcholine. You're making a lot of acetylcholine, so it slow down your heart. The treatment of choice, if they become crisis, is give them atropine for their hearts to slow down. It blocks the acetylcholine. So atropine is the antidote for overdose. And based on that, you can use it to answer your question. So what is the ask? Which of the following assessment is appropriate? SATA. She was prescribed what? Neostigmine. So a client with the known myasthenia gravis was admitted with crisis and prescribed neostigmine. So you know what it is. It's pharmacology. I already given you the idea. So that means we're making more acetylcholine. So what assessment do you want to? So too much acetylcholine, urine output, what is going to do? Yes, it's going to go up. Eye exams. Um, what do you think? Yeah, pupillary, the pupil will constrict. You got to check the eye exam. Oral care. So this is good. This is good. Oral care. I don't think they're making a lot of saliva. If they have anticholinergic and their mouth is dry, yeah. But oral care, their mouth is like moist. They're making too much saliva. So yeah, somebody will say yes because you want to prevent aspiration, but I don't think they will aspirate from that. Cardiac monitor, yeah, because their heart rate will go down. Bowel habit, yeah, they're going to have diarrhea. Atropine at bedside in order to counteract all these side effects. And you can see how SATA selected apply is all coming from the content that we know, that we have already established from the front, and we don't compare. We just make a decision and move on. So that's that one. One more question, of course, prioritization. So we're putting everything together in a form of prioritization. It's the same thing, selector that apply. The client, which of the following patient need priority intervention? And next caring of 5 patients. So the same thing, we go through and see who need a priority intervention. A client with myasthenia gravis complaining of incontinence to the bowel. I just told you, bowel is not my problem. There's only 2 things in myasthenia gravis that I should worry about: swallowing and breathing. Therefore, this one negative. Client with trigeminal neuralgia with severe, sudden onset of electrical sharp pain with chewing. Well, good luck with that. That one, it doesn't need to be seen. You are not being sharp if you make this patient your choice. You have to be sharp and don't let them trick you with all these tricky words. No, all this is telling me patient has pain, which is suspected. Therefore, I'm not seeing. A client with Bell palsy wearing glasses at night. So this one is wrong. You have to wear glasses during the day and then patch at night. So this one we got to intervene and tell them, hey, you're doing something wrong. A client with cranial nerve 5 palsy on carbamazepine with the temperature of this. So you got to know cranial nerve 5, which is trigeminal. They're taking carbamazepine, which can lead to agranulocytosis. And therefore, there are risks of infection, becoming septic, and a B-sharp movement. Temperature of 100 is unacceptable. And therefore, we have to do something. So this patient needs to be seen. So this is the end of it. 3 big neurological problem. And we explained it with the question. I think that's the easy way to understand that. I hope this helped. There's 3 more left. But take this for now. Enjoy yourself. Take care of yourself. Prepare strong, and you'll be fine.